Hello, friends. Janice Mitchell, pelvic health physical therapist, and I have my friend and fellow pelvic health physical therapist, Dr. Heather Jeffcoat at the Lady Parts PT. So we are very, very excited about her upcoming course that MyPFM is hosting, and this is a virtual course. We've been getting a lot of questions because this is a full 2-day course, and
Yes.
in the past, these have been on-site courses. And now with our new environment, we're offering this virtually. So how is it going to look? And so we're going to go over some of the frequently asked questions. If you have a question that we don't cover, please feel free to reach out to us. All right, so let's jump right into the first one. So what are some of the advantages of the course being offered virtually?
Well, I think the biggest advantage is that it's going to be recorded and you can access it after, because normally when you're going to a Con Ed course, you're hearing it, you're writing notes, you're just trying to keep up, but also absorb what's happening real time. And you never have a chance to go back. So, sometimes I'll find myself like with my neighbor, like, wait, what did she say right there? So, when you sign up, you have access to the recording online. And I think that's a huge advantage that you just can't get in person.
Absolutely. And you'll have access to this course for 12 months from the date of the course. So you can go and review it at your convenience in the comfort of your own home.
Yeah. Another advantage too, the obvious of like any virtual course, like you don't have hotel, you don't have airfare. I just had a direct message on Instagram from someone from Turkey that said, how do I sign up for the course? So I just, sent her the link. The link is in my bio. I think the link is also in your bio. Yes. So, it's, people internationally are reaching out to take this course. So it's really making it a lot more accessible to everybody at, lower price point than 2-day courses typically are. Plus you don't have all that added travel expense.
Exactly. And then you also just have the safety factor too, because right now we're in the COVID-19 era, right? And so we're being creative about ways to be able to connect this information. One other little advantage I wrote on here too is that you have a choice of partners. So you can choose what vagina you want to work with.
That's true.
So at courses, unless you travel with a partner and you remain with that partner the whole time, which is actually, not usually the case, you really don't have the choice. So for the lab time for this course, you'll have the choice of what vagina you want to work with.
There you go. Or a faux vagina, which I'm actually researching options for that. And I've actually come across a low-cost option that I've asked the manufacturer to send to me. So if that works, then, I'll be able to extend a discount for that for people to purchase that before. So they might have a faux vagina to work on at like a very reasonable price.
So let's just jump into that a little bit, because there's been a question like, how are you going to do lab time with it being a virtual course?
Yeah, so for one, that's why I made the requirement that they have to have at least had like a pelvic floor level 1 or equivalent experience, because it's not going to go over like learning individual muscle palpation. Like I think a level 1, there's just really not anything to replace that type of experience on a real human, right? But if you have that baseline function, then or that baseline education, then you're just learning techniques, and like where the levator ani is, where the obturator is. So you can approximate that with a model and then learn the proper areas to go to. The class isn't just about palpation, we're kind of delving into the lab part of it. But when I go through the whole educational plan, we'll be presenting first, we're talking about female sexual function, because in order to treat dysfunction, you have to understand normal function. Right. So we'll be going over that, as well as like the female orgasm response, and whole lecture on the female orgasm. So, so everyone will be an expert in female orgasms by the end of by lunch. By lunch, they're going to be experts. Yes. Yeah. And
and then sorry, go ahead.
I was just gonna say, and then like going into dysfunctions, then we're talking about interviewing technique, what are the most common presentations, and for me, I present it as what I feel is like the least challenging, and then go to more layers of challenge by diagnosis. So we start off with vaginismus, and then move up from there, ending with endometriosis. Sort of my spectrum of complexity. I used to be the one where vaginismus, like, oh my God, a vaginismus patient. Oh my God, they're so hard. And now I'm like, it's the easiest thing. Like, give me more vaginismus. Like, love me some vaginismus. So I presented it in a very like clear pathway, and how I've arranged the manual for everybody too is in sections. So, if you have a vulvodynia patient, you can go to the vulvodynia section and see everything, including the history. So there will be like some things repeated, but I feel like that manual is going to be more user-friendly for you after the course, because you can just go to your section and have everything you need. You don't have to flip back to like section 2 and then a little bit of stuff in section 4, and then, I think it's going to be almost like all-inclusive within each diagnosis as much as possible.
Good, good. And to tag on a little bit for some ideas with lab time. So the course schedule, we're going to have very structured times where this is lab time. So if you have someone that may not be taking the course that's willing to come in to be your model, you'll know in advance, okay, this is when I need a live vagina.
Right.
And then there's also some opportunities that if you wanted to take the course with a coworker, which is what I'm doing, we're actually going to be hosting it at our clinic. So we're going to be practicing on each other. And then as well, like the faux vagina, and we have some other creative ideas as well if the faux vagina doesn't work out. So there's plenty of ways and opportunities to be creative with learning.
Yeah, you have to be.
Excuse me. So in terms of the actual course schedule, it's going to be 8 to 5, Saturday and Sunday on the 27th and the 28th of June. And this is Pacific Standard Time. Yes. So that's LA time. That would be, in terms of New York time, that would be 11 a.m. to 8 p.m. Mm-hmm. Yeah. So wherever you are in the world, if you can join us live, and again, you can join us live for all or part of it, because we're recording it and it will be available later for you to view at your convenience.
Yes, exactly. I did have someone reach out from Australia, and they specifically asked if it was going to be recorded, because she's like, it's just not the time.
We're such opposite time zones.
Yeah.
I think Europe is a little bit easier, at least for the earlier part of the day. Sure. What types of providers can attend? Do you have to be a pelvic health PT to attend?
No, and that's a great question, because I'm almost like correcting people. I see some people reposting, and so then I'll repost it and say, not just for pelvic PTs, right? We have pelvic health occupational therapists that can do this, OBGYNs, urologists. When I taught this course in Europe last year, I had a couple urologists, I had an OBGYN in there, doctors of osteopathic medicine, anybody that does female sexual health that is licensed to do physical exams, intravaginal exams, and things of that nature. So, so those are, anybody that's licensed to do so can take it.
Yes. Okay. You will get 16 contact hours of continuing education credit. At this point, the course is not actually approved in any state. So you'll need to go ahead and apply for the approval, but we'll supply all the documentation and you will get 16 hours. And then in terms of discounts, if you sign up prior to 2 weeks before the course, you get a 10% discount. Also, if you are a MyPFM Pro or Pro Plus member, you get a 25% discount. So you can become a member, you can direct message me, the link is in my bio, the link is also on our website, mypfm.com, but we are a nonprofit pelvic health awareness campaign, and so we are giving that as a perk to our members. Okay, I think really we're recording it. We talked about the time zone. I believe that we have really covered the frequently asked questions. Is there anything else you'd like to share before we go?
I just think that this is going to be a great class for people that want to delve into the specifics of what they learned in like a PF level 1, level 2. If you want to see a lot of female sexual dysfunction, or you already are, but you just feel like you're not quite getting it there, one of the big things we're going to spend a lot of time with talking about is the history, because if you're not getting an accurate history, you may actually be making progress, but the patient and you don't realize they're making progress because you didn't ask the right questions to begin with. So history is going to be something we cover a lot, which will make you a better therapist. And then you can layer on your awesome manual skills, education skills that we'll also cover to just make you, a more complete therapist for women's sexual health.
Absolutely. And even if you've been a therapist for a long time, I guarantee you that you will learn something new, or you will have a trigger like, oh yeah, I remember learning that, but that wasn't in your forefront of your thoughts in your clinical decision-making process. So I encourage every level to come check us out. If you have any questions, let us know. Heather, I'm really, really excited about the course, and we are just about 1 month away. So still time to sign up, and let us know if you have any questions. Thanks again,
Thanks,
everybody.
Denise. Bye.
Bye-bye.